Welcome back to Focus on Health. In case you're joining us right now, our topic today is mental health. With me on set is Daktari, and is going to be guiding us as we demystify mental health. Thank you, Daktari, for joining us. It's a pleasure having you here. Daktari, even before we head on to our topic today, kindly introduce yourself to our viewers.
My name is Dr. David Wairoto. I'm a consultant psychiatrist and also lecturer in the Department of Psychiatry and Mental Health here at Kenyatta University. So thanks for having me, Michelle.
Daktari, our topic today is mental health. How would you define mental health?
So mental health is a state of well-being in which an individual is able to achieve his or her own capacity. Secondly, an individual is able to cope with their normal life stresses, okay? And thirdly, they are able to work productively and be able to make a positive contribution to his or her own community. So that's the definition from the World Health Organization.
What is the importance of mental health? Why would you encourage people to have good mental health?
So mental health is very important because for all of us, it's the core of our human being. So when you are well in your mentally, you are able to achieve your own potential. You're able to actually help your community, deal well with the society, and also be able to be productive. So it's important that when someone where we are focusing on health, we also focus a lot on mental health. Currently, there's a lot of focus on mental health because of the COVID-19 crisis, and as mental health practitioners, we are trying to raise awareness and know-how for people to be able to manage mental health early, to be able to avoid a lot of challenges and societal issues because of mental health.
Doctor, you mentioned something about COVID-19,
Yes.
and currently we're experiencing the pandemic, and of course it has come with a lot of anxieties and frustration, financial constraints, people have lost their jobs. Are there some of the mental illnesses that have increased due to COVID-19?
Thank you, Michelle, for the question. So we are currently seeing an increase in depression. So we are seeing because of the COVID-19, many people are forced to stay at home. People have lost their jobs, they've lost their livelihoods. People are also staying more home with their families, and for some families, they were a bit dysfunctional, so it was not common for the man and the lady staying in the same home with their children. So depression is the most common mental illness which we are seeing now because of COVID. Secondly, we are seeing a lot of substance use disorders, more so alcohol. People are doing a lot of deliveries at home. They're also inviting in a lot of alcohol because you work from home, so you don't need to go to work for you to be productive. You can work from your laptop or from your home office, so that has also increased. We're also seeing a lot of what we call abuse, so especially of the children and the women, children and women abuse because of people staying at home. So we are seeing a lot of domestic abuse, which is also on the rise. Thirdly, fourthly, because of the COVID-19, we're also seeing a lot of stigma. So there's a lot of stigma. When you tell your neighbor you have corona or you have COVID, these are people who alienate you. They don't want to spend time with you. They stop calling you. They think you'll infect everybody. So that is something which is also on the rise. And lastly, we are seeing a lot of burnout. So people are having what we call Zoom fatigue. You're tired because of doing the Zoom meetings. You're tired of staying in the house. You're unable to go travel. But at least now with the relaxed restrictions, that one is on the decrease. So because of COVID-19, I would encourage our viewers, this is the time now to seek a counselor or a mental health worker. If you feel overwhelmed, reach out to them. We have hotlines. We have people who are there for you. So just reach out to them, and we are willing.
Apart from the negative side that COVID-19 has, or rather the impact that it has had when it comes to mental health, is there a positive side to COVID-19 as regarding mental health?
Yes, thank you for the question, Michelle. So what positivity we've gotten from COVID? People are now having more communism. People are reaching out to their families. Remember, human beings are social creatures. So we benefit from those close ties with our families, with our loved ones. So that has actually improved. People are also praying a lot. So there's a lot of also spirituality. I know some of the patients I see are more reaching out to their pastors, to their reverends. Priests are doing home visits for the people who are unwell. So that is very positive. And then as a positivity, we are seeing now even the community. People actually trying to assist each other in terms of coping mechanisms. People are doing Zumba, people are doing exercise more. So I think it's also quite positive. And as a country, we are now talking about mental health. We had a lot of stigma associated with mental health, but everyone now is actually admitting that it's very important that someone has good mental health for them to work productively. And many organizations are actually doing ways and they're actually doing programs to try and help the staff to relax at home and be able to improve their mental health. So it's also positive as well.
Dr. We've talked about the various categories. We have the adults, we've talked about the children, we've talked about the elderly, but is there a specific demographic that is actually more prone, or rather falls under the ambit of, getting mental health illness faster than the other?
So in mental health, we call them special populations. So there are special populations who are more prone, and we are very alert as mental health workers to actually look at them well. So number one, we have women of all of reproductive ages. That's usually from the age of 15 to around 50. For Africans, sometimes menopause goes until 55. So for women, we are really keen. So even in the ANC clinic, and they go for the normal clinics, we try and actually administer some questionnaires to try and actually screen for depression, anxiety, and any other common mental illness. We also have children. So our children, remember, they're the future of our community and society. So for children, we work well with the pediatricians, and the pediatricians we have actually gotten a training in mental health. So they are able to pick early any mental issues in children and refer appropriately for the psychiatrist and the mental health workers to be able to manage early. Thirdly, we have the elderly. And when I mean the elderly, I mean adults above the age of 50. So for them, it's important that we actually take care of them. Remember, many of them have retired, so they've lost their source of income. They also feel they are not as productive as they were in the society. Some of them have lost even the stature which they had. So these are adults who we really try and focus on. And then fourthly, we have men as well. People are saying we are forgetting men, but we are not forgetting men. So we are also focusing on the male gender because of testosterone, they're also prone to a bit of high risk behavior. So we know the Subaru kind of youth who drive cars very fast, take a lot of alcohol and cannabis. So we are also trying to focus on that demographic.
Let's talk about the link between depression and suicide.
Thank you so much, Michelle. So depression is an illness. I'll define it very simply. It's an illness where you have a chemical disturbance in the brain, and we have three main chemicals which cause disturbance. We have serotonin, we have norepinephrine, and we have dopamine. So when you have that chemical imbalance, you get features of a low mood, you have a loss of energy, you have changes in appetite, you have changes in sleep, you also try and keep to yourself a lot. You might find yourself drinking more than you drink, getting quite irritable, and these symptoms usually last for more than 2 weeks. So that's what we define as depression. Now for suicide and depression, they actually occur, depression actually leads to suicide, and it's important for us as mental health workers and as the community to identify when someone gets depressed, because when you get depressed and you are not able to get good care, you'll find yourself having suicidal thoughts, and unfortunately in many cases people become suicidal and they actually even commit suicide. So what I would actually urge the viewers, is to make sure that when you have any changes in your mood, you find you are not sleeping well, you have changes in appetite, seek care here at the healthcare unit at Kenyatta University or any other medical facility. We have trained our doctors, our nurses how to identify and recognize depression and other mental illnesses, and they'll be able to actually refer or start you on medication. Yeah, thank you so much.
Dr. For instance, if you have a family member or rather a friend who is suffering from a mental health illness, how would you encourage us, as the family, as a society, how do we take care of this person, of this patient, and even how do they also take care of themselves in order to be able to, recover quickly?
So the first point I would really encourage our viewers is to keep in touch. So you need to keep in touch with your family, with your relatives and your loved ones. So we call it social connectedness. So let's have a lot of social connectedness. Let's keep in touch. For the young people, I'll encourage them to use even the Facebooks, the Instagram. There's one called the House Party I hear. So let's use all these social media platforms to try and actually reach out to family. The second thing we need to do is open up. So we really encourage people to ventilate. So it's important when you feel you're overwhelmed, you need to ventilate and talk and let it out. It won't harm you just whispering to someone, I'm feeling low, I need some help. And more times than not, in other individual will have passed through something similar, so they'll actually help to support you. Thirdly, what we encourage is spirituality. So for people who have a religious leaning or basis, we encourage them to continue with the church, the mosque or the temple. Let them reach out to their religious leaders. Let them pray with other believers. It will help them to cope and deal with these times where things are a bit stressful. Number 4 is exercise. So I'd really like to stress, especially to our younger viewers, that would need to do exercise. According to the NICE guidelines, we recommend 150 minutes of moderate to severe intensity exercise. So doing 30 minutes per day of a walk, perhaps doing some aerobics in the house if you have nowhere to walk, doing a jog once a week, that is really encouraged. For people who are in the office like myself, we encourage something called a buddy system. So a buddy system means that you and maybe your desk mate or your colleague, you share with each other your problems, and you're able to cope with each other and help each other to strengthen the bonds. Okay? And then number 6, what we actually encourage is now this kind of awareness. So we are actually encouraging that partners like you, K.U TV and other partners can reach out to us, mental health workers, to now reach out to a bigger community to encourage ourselves that mental health is just an illness, but it's there and we are able to manage it.
Dr. Even as now we wind up, what would be your clarion call, or rather what are your final remarks to our viewers regarding mental health?
Thank you so much, Michelle. So my parting shot to viewers is that mental health is very important, and we are really stressing that as individuals we take care of each other and we reach out to each other. His Excellency the President, Honorable Uhuru Kenyatta, set up a mental health task force which was chaired by Dr. Frank Jenga. And he recommended that we set up a mental health and happiness commission, and we also declare that mental health is an epidemic of epic proportions. So I would encourage viewers that we are there to reach out to you. We have a very good health unit where we have a psychiatrist here at KU who sits every Friday. We also have a department of mental health. So in case of any questions and clarifications, feel free to reach out to us and we are there to help you. Thank you so much.
Thank you very much, Dr. It's been a very informative session. That is all the time we had for today, and there you have it from Dr. Health is Wealth. So let us be open about mental health. I've been your host, Bari Michelle. Until next time, stay healthy. I will leave you with the Health You segment.